Good afternoon. I'm Bruce Liggett, the Human Services Director for Maricopa County. I'm really pleased to have been invited to present at the Oregon Housing Conference. I, like all the other speakers, absolutely wish this could be in person. I do best when I can see the people I'm speaking to and we have a little interaction and dialogue and chance for questions. But I still think it's really important to be able to go over, and I'm looking forward to listening to the other presenters during the conference. So let me first start by providing some background in terms of Maricopa County, Arizona. Let me give you a little background, first of all, in terms of Maricopa County. It's a very large and diverse county. We've got over 4.5 million people. It's been for many years the fastest growing county in the United States. We have 25 cities and towns, some small, some very large, the largest being Phoenix, with a population of 1.7 million people. Since it's the biggest city, we've got great relationships with them and coordinate our activities around our homeless planning extensively with the city. A little more background perhaps on the Maricopa County Human Services Department. I've been with the county now for 7 years, and it's a very unique array and arrangement of services in terms of Maricopa County. We have early education, which is Head Start primarily, community services, which is really our anti-poverty arm, our community action programs, where we provide rent assistance, mortgage assistance, and primarily utility assistance. There's been a huge demand and need for those during the pandemic. Our Housing and Community Development Division is responsible for affordable housing, primarily in some of the smaller and medium-sized communities. Some of the larger cities get their own direct funding. But with funding from HUD, we're able to do much housing development, as well as all of our homeless work. Workforce development, we operate workforce services throughout the county, except the city of Phoenix has their own. So again, we work closely with the city to make sure we have regional approaches to our workforce services. And finally, senior and adult services, where countywide we provide case management to individuals who need home and community-based services to retain their dignity and be able to stay in their homes safely. Some overarching themes and initiatives that are part of the department and really kind of in the context for how we do our work. First of all, there's quite an array of responsibilities for human services in Maricopa County. The federal government has a role primarily as a funder. The state also provides funding, but the state operates the public assistance programs, the SNAP, TANF, unemployment insurance, child support enforcement. Counties fill in the gaps, receive funding from the federal and state to administer the program, and Maricopa, being the largest county in Arizona, works with a lot of local communities who may also have their own human service departments. Given this kind of shared responsibility, sometimes could create gaps, sometimes can require more coordination, but the need is overwhelming. None of our programs are in scope or scale with the need. So the only way we can really address all of the needs of the people that we're trying to serve is through partnerships. We have robust partnerships with 130, these are formal partnerships, organizations, nonprofits, public entities, faith-based organizations. So we do our work by partnering. Within the department, we have a lot of cross-generational and program initiatives. So we work, for example, our workforce program tries to help Head Start families get jobs that they may need. Our workforce program also works with the homeless population. Our community services program provides utility assistance for seniors. So we've really tried to integrate the various programs and all of the narrow funding streams that create so many barriers for people. As part of that, we've got a major emphasis on 2-generational approaches, trauma-informed care, and whole person, really looking at the whole person, trying to move away from the narrow scope of services that are available to people and provide comprehensive services that meets the family's need. We do a lot of collaboration with other funders and have on homeless. In fact, our work with a funders collaborative with the state, the city of Phoenix, and United Way 3 or 4 years ago resulted in a major depopulation of a parking lot that was then used for people with no services available. And we were able to get hundreds of people into housing as part of a collaboration. So you can see this is how we do our work. We work with others to try to meet the need. The resources are limited. And then what hit us all was the COVID pandemic. So I'm really going to focus today on the homeless challenges and our responses to them. Many of these are going to be familiar to you. We're doing some things I think that are unique, but largely what we're doing is what everybody's been doing and scrambling for the past 8 or 9 months to put into place what's necessary to really provide for safe, secure, health-related care for homeless individuals. So we've done best practice reviews and sharing, exchanging information with CDC, HUD, USICH, other states, other counties, and the cities. We try to stay on top of it. There's a lot of good information out there, and it's hard to keep up. Maricopa County's approach was through our emergency management system to combine public health, emergency management, and human services as a part of that as a unified command, sitting down at the table with all the entities to plan our actions. We've got a very good relationship with our public health department. It's been a challenge to kind of balance the urgency of the situation and collaborations. I think collaborations have suffered because as we received the CARES Act, the federal funding, and had urgent needs, whether it was for utility assistance, housing, homelessness, safe shelter, we had to respond immediately. And while we tried to share information, we're not working as collaboratively as we used to. We're getting back on track there now, but I think that's been a really stressor for the system, a real challenge. We have relied extensively on regional providers. The healthcare for the homeless provider, here called Circle the City, engagement and mental health providers, an agency locally known as Community Bridges, and working with the downtown Human Services Campus. Now, I should explain, the Human Services Campus was established about 15 years ago. There are 12 separate nonprofit entities that operate in that campus. It's the largest concentration of homeless individuals in the state. They provide services to 1,000 people every day in and around the Human Services Campus. Another approach we take is as we think we learn something, whether it was a good experience or we learn not to do something else again, we try to share those protocols, lessons learned regionally. The biggest overall challenge has been so many unknowns. When we began this, there were a lot of estimates of how many people, homeless people, might be impacted, and those were huge ranges of responses we might need. I've said often, if I knew back in February and March what I knew now, things would move even better. Now the unknown is, when will this end? When is the end? If somebody at least would say this will be April 5th, we could plan around that. So we're really going along, trying to stay on top of the situation as best we can, but it's been a huge challenge for us. More specifically, let me go through some of our strategies for addressing homeless population who are at risk or have contracted COVID-19. The first thing we did is work in and around and with the Human Service Campus and the providers there to be able to put in protocols to screen, identify, and test individuals for the virus. Those protocols were put in place and shared with other shelters around the county. We provided tens of thousands of personal protective equipment, PPE, and informational materials to providers, how to identify symptoms, what to do if somebody is believed they've been exposed to coronavirus. Over the past 8 months, we've had leases with 6 different hotels for vulnerable and at-risk populations. These have been in Phoenix, as well as other parts of the Valley of the Sun, the county. Today, we only have 3 of those hotels. Some of them have continued to operate by cities themselves. So the number keeps changing. One specific hotel was leased for people who are positive, who are known to have the COVID virus, and for people who are under investigation, who may have been symptomatic, may have been tested, and need medical supervision, isolation, quarantine. So we've got a hotel that accommodates that, and that numbers have ranged. For a while, the number in that hotel was 20 or 30. About a month ago, maybe a little longer, it dipped down to 1 or 2 per night. And recently we've been up as high again as 30, some nights 50. People don't stay there long. They stay there while they're quarantined or getting medical treatment. If their condition worsens, obviously they go to a hospital. We've established a triage line that was designed for hospitals. Not every homeless person is in contact with a mental health provider or with a shelter. So there are people in hospitals who are being treated who report that they're homeless. When they're ready for discharge, we have a triage line that hospitals or shelter providers can call to talk to somebody who's knowledgeable about what to do in certain circumstances. If people need to be transported to one of our vulnerable hotels or to our COVID hotel, transportation is provided. Early on, we knew that we had to address the large encampment of people in tents and outside of tents in and around downtown Phoenix, specifically around the Human Services campus. So we implemented a voluntary test distancing site to provide a temporary, and we emphasize temporary, didn't know how temporary it would be at the beginning of the virus, a safe outdoor space. So there are 3 county lots that are being used, again, in downtown Phoenix, close to the Human Service campus, where we put in additional dumpsters. We've added toilets, hand washing stations, had to bring lighting, nighttime lighting into the situation, a large water station, and security. And those services can be used by people who are using the safe outdoor space or the tent lots, as well as other homeless people who may choose not to come into the tent lots. Throughout the country, we've all had to reduce some of our shelter capacity. That became a real challenge during the intensely hot summers that we have here in Arizona. With temperatures exceeding 110 often. So we knew that we had to have additional facility, which we established. The city of Phoenix did a great job of providing daytime weather relief for people at their convention center. And then we had some smaller facilities where people could stay during the night. City of Phoenix coordinated transportation between these weather relief sites. And so we were able to provide weather relief for people. In fact, we had capacity still available during evening weather relief. So we're pleased that we were able to respond to that unique need since shelters weren't available there for as many people as they had been previously. What are our next steps? We're obviously continuing to actively monitor the situation, track what's going on, count the numbers, see the trends. To date, I'm pleased that there's been no data that's been available that the homeless population has been disproportionately impacted when compared to the general population in terms of the percent of positive cases within them. So our efforts have made a difference. We need to stay vigilant. We know the flu season has already started, and so that's going to put an extra strain on our system. Our goals, like many others, are to provide housing for people who we placed in hotels first. So I mentioned the 6 hotels we've established. A couple hundred people have been utilizing those hotels. They're older, they have medical conditions, they may be seniors. Those are the people who are our priority to not have to move back into the shelter, certainly not into the street. But the plan there is to try and find permanent housing for people who have been vulnerable and in our CARES-funded hotels. The next goal is for utilizing the hotels where we have some capacity. And as some of our numbers have dropped, we're retaining those hotels and we're going to use those for bridge or transitional housing for people. So we've got that capacity now and are developing plans to put people in through rapid rehousing or permanent supportive housing. Again, the ideal goal would be that nobody has to go back into a shelter that has been in a hotel temporarily. We also want to we're trying to utilize our funding that we have through Community Services Block Grant, Community Development Block Grant. Those funding sources have a little bit more life than does the CARES funding. Perhaps I should explain. Overall, we're estimating that these efforts this year, we will have spent about $12 million. And that is primarily from CARES Act funding, which, as you know, expires on December 30th. Some of the other funds that we received directly from HUD, Emergency Services Grant, for example, last in another year or two. So we're putting together a plan because the CARES money, the $12 million, runs out December 30th. The services we've been providing cannot run out December 30th. We're very hopeful that Congress will act and add additional money, not only for our homeless services, but for the preventive services. We know with the eviction moratorium, the CDC eviction moratorium ending December 30th, that there's going to be a huge impact on people who have been unable to pay their rent or utilities, and that the funds that we've used to assist are dwindling and ending. So we really do need congressional assistance in human services for more, to continue the services for housing, homelessness, rent, and utility assistance. So putting together, we are actively working as we speak here in the end of November for what the plan will be to fund these programs beyond December 30th and how to sustain them and how to meet our goals of trying to provide housing for people who've been temporarily housed or need to be placed. So preparing for the vaccine is a big part of that work. We have all heard the positive news that the vaccine may be available in the next few months. The populations that will be a priority obviously will be first responders and healthcare professionals, people working in that field. We know that people involved in long-term care facilities will also be a priority, and so will the homeless. The homeless as a vulnerable population will be a priority in terms of rolling out the vaccine. When will it be here? How will we distribute it? All these things are going to be developed over the next month or two. So I guess in my long career in human services, one of the things I want to acknowledge is how privileged I've been to be able to work with the nonprofits and the cities and towns in Maricopa County to address homelessness. It's been an ongoing challenge. Homelessness has increased in this county over the years significantly, 18% in the last year. Unsheltered homelessness has increased, and yet we've all worked together, responded in a crisis situation, and provided services that have made a real difference to homeless people in this county. So the efforts have paid off and have made a difference. And we're going to try to build on those efforts for the future, take advantage of the short-term resources and build structures and systems that can be in place for people ongoing. So I really appreciate the time to be able to provide this overview to you of what we're doing in Maricopa County. The work that we do is in coordination with the City of Phoenix. We have a great partnership with them to address a really significant challenge. Our work is gratifying, as your work is. And so thank you for the opportunity to provide you an update on what's going on in Maricopa County and Phoenix, Arizona. Thank you.